Well, it's lovely to have you here tonight. This is our second session on anxiety and stress management, and I hope you'll really enjoy it. And this is the last talk I'm giving in this little series. Thank you so much for being with me over the last few weeks, and I hope you'll have found it helpful and to you in many different ways. As I mentioned before, if you can have questions, please put them in the chat session. And then after this first talk, which is about half an hour or so, we'll then deal with some questions. And then at the end, we'll have a kind of spiritual reflection, as we usually do. I'm going to just run through one or two slides just to remind you of what we talked about last week. Also, just to remind you that if you wanted to still give a donation to the Dalit Freedom Network, feel very free to do that. And also my book here, Mindful of the Light, Practical Help and Spiritual Hope for Mental Health. You can get that through Amazon. So that's the last plug for that. So anyway, we talked a little bit about anxiety and stress management last time, and we obviously give the usual disclaimer that the information is of a general nature and should not be construed as giving particular advice on individual problems. You remember we looked at what anxiety was, and then how anxiety and fear can affect our minds, and we thought of different ways in which it can affect our minds, and then we also looked at different ways in which it can affect our bodies, with all kinds of bodily systems being affected by anxiety. And then we went on to look at how it can also have interpersonal effects and affect our relationships if we're not careful. And we can either withdraw or we can become irritable and take it out on others if we're not careful. So different ways in which anxiety can affect us. We thought a little bit about how overbreathing is involved in anxiety, and also how that can create faintness. And we thought a little bit about panic attacks and how they can affect us. And then also a little bit about controlling our breathing can be a great benefit and help to us in facing anxiety. We also thought about simple ways of relaxation. And of course, every one of us needs to find time and ways in which we relax. We also thought about how physical health and strengthening our bodies also helps with anxiety, and how physical exercise is so beneficial in all kinds of mental health situations. And I gave there some further resources, which are basically the same ones I want to give today. So I'll leave that up for a moment in case you want to take any notes there. As I said, livinglifetothefull.com, as you'll see down there, is very, very valuable. And also livinglifetothefullwithgod.com is also very, very useful there. And those websites are by Professor Chris Williams, who's very useful resource through what he does in this whole area of anxiety. And then we thought about the, one or two spiritual reflections. So now I want to move on to the second part of this last talk, and we're doing anxiety and stress management 2. And again, there's my YouTube site. So many of these talks will end up on YouTube. And if they don't end up there, one or two of the earlier ones weren't recorded, you'll find similar talks there, perhaps a bit longer, that will also point you in the direction of some things I've done in the past. So I want for a minute we talked about last time what is anxiety. Maybe we should look at what is stress. Well, stress obviously is a feature of everyday life, and none of us can live without some stress in our lives. It's common, it's everyday, and the the question is not whether we have stress or not, but in a sense, how we deal with it. You might think of stress being an alarm response to threats and producing increased arousal and a production of a lot of adrenaline in the body, and the body is prepared for what we call fight or flight. You can imagine that if you're in a field with a mad raging bull, then you've got two choices. What first choice is maybe if you're a strong young man with a kind of, and you fancy being a matador, you could try and slay the bull, but most of us would probably in that situation actually end up running faster than we've ever run before and jumping higher than we've ever jumped before to get out of the way of that mad raging bull as fast as possible. And so this stress of that bull is driving our bodies to put out lots of adrenaline and we're prepared to flee from that situation. But of course, one of the difficulties is if we are stressed all the time, then the body's always putting out that adrenaline and also another hormone called cortisol. All those things are happening in our bodies. And not only do we end up mentally and physically exhausted, but it can also affect such things as our immune function as well, because we're constantly under that degree of pressure. And in that situation, we might say there's a bit of a mismatch going on between the external demands upon us produced by the stress that is hitting us and our abilities to cope with it. So there's a mismatch going on, and it's producing all that adrenaline, all that cortisol, and we're getting mentally and physically exhausted. As I say, there are also other physical effects of that if that carries on long term, not just only on the immune system, but partly also on other bodily systems. So that is stress. Now, this graph here is quite a useful little graph, I find, to explain it a bit further. It's called the Yerkes-Dodson curve. And as you can see there, it's kind of a bell-shaped curve. And on the left-hand axis is your quality of performance, and on the bottom axis is your level of arousal. Now, if you have very little arousal and your quality of performance is not called for, then you're probably asleep, which is down in the bottom left-hand corner on your screen. On the other hand, if you're listening to something in a rather disinterested way, you're bored. I hope you're not bored tonight just yet anyway, but there your quality of performance is not being really a trouble, and your level of arousal is fairly low as well. However, you see that you move up to what is called mild alertness. In that situation, you're probably maybe driving to work or something, or you're getting ready to do something, and you're aware that you're becoming alert in the situation. You want to begin to perform well, and you're alert. And so that is the next step up. And at the top of the curve is the optimal level, where, yes, there's a certain quality of performance and a certain level of arousal. You might say the level of arousal is related to stress as well. You're in a degree of stress, but you're at your optimal level and you're hopefully performing well. And I always think in these talks that I hope I'm hitting the optimal level, but if you ask me any very difficult questions, then I'll probably tip over the top and get stressed. And when you're stressed, you can see there that your level of arousal has gone up higher, but actually your level of performance has begun to dip. And I often come across that in sometimes when patients come to a clinic. I've run memory clinics before, and I find that people in the memory clinic can come in and they're aware that their memory is not so good. And it's not because there's a serious problem of the memory, it's because they're stressed and they're not taking in information very well, and their level of performance is not so good. So you can see if you don't manage stress, then actually your level of performance goes down. And then obviously further on down the graph, you get frankly anxious. Again, when your level of arousal is very high and your performance is going down. And then at the bottom, you might think of panic episodes where your level of arousal is extremely high and then your quality of performance is poor. So you can see there that in a sense, yes, stress is part of everyday life, but managing that stress and trying to live life reasonably at the optimal level or mild alertness is the way you want to live it during your times when you're obviously demands are being made upon you. Obviously down there and sleep, obviously it's not so important, but that's the way that stress is related to performance. And I think that graph is quite interesting. Just thinking a little bit about stress management, and obviously a lot of this is fairly commonplace. You can find articles on this in all kinds of magazines and whatever. This is not terribly up there, but it is important to manage stress in our lives. And so we can identify, for example, the sources of stress, and sometimes a stress diary can be helpful. And what you might think of doing there is, doing a daily record for a week or so, or longer if you wanted to, of actually what things in life are causing you to be stressed, and how you're experiencing that stress, and then in a sense, how you come through that period, what actually then you deal with it and what happens in it. And so sometimes, a stress diary like that on a daily basis can be useful. And sometimes what it will also show up is quite interesting, is that not all stress is necessarily to do with everyday activities and time pressure, etc., which we'll move on to discuss, but sometimes it can be the result of unresolved deeper problems, maybe relationship issues, maybe difficulties with maybe social anxiety, social phobia, other things underlying the stress. And so some of those things can be there, and writing a stress diary can be a way of, in a sense, identifying some of those other causes of stress in our lives. And of course, with stress, it's very easy to blame others, and it's very easy to blame circumstances. We can always say that it's everybody else's fault that I'm so stressed, or it's all the fault of all the circumstances in my life and I'm so stressed. But actually, we grow, I believe, as we learn to take responsibility. And, taking responsibility for the stress in our lives can be a very useful and helpful thing to do, as you can kind of look at what stresses you're under and how you can manage those stresses. So taking responsibility rather than blaming others and blaming circumstances is a very useful thing to be able to do. And of course, unhelpful ways of dealing with stress, we all know this, but smoking, drinking too much alcohol, using other pills or drugs to relax, overuse of those things, sometimes collapsing for hours in front of a TV or computer without actually looking at the source of the stress, over or under eating, comfort eating, of course, procrastinating, putting things off and never really dealing with the things that are causing that stress. Here's one, filling up every minute to avoid difficult issues. I wonder if anyone else has done that. I probably have done that at certain times, trying to avoid looking at the underlying issues, whereas actually facing them is usually the best idea. And of course, withdrawing from others and people, activities, and taking it out on others are all things that we can do. So those ways are unhelpful. As I mentioned before, usually in this whole area of stress and anxiety, facing up to the stress and facing up to the anxiety are usually the way forward. And how do we face up to stress then? Well, I think there are 4 things here that we can do. Avoid it, say no. Learning to say no is a useful skill. People will often put us under considerable demands. And sometimes to learn to say no to things is useful for us. For example, even over the last few weeks, I've had to say no a few times because some people following these calls have wanted to involve me in their personal situations. And although, you know, in many ways I would love to get involved, I know that medically that would not be wise for me, because that's more the role of your local doctor and your local team if you're involved in others helping you. So saying no is sometimes difficult, but we sometimes have to do it. Sometimes reducing our to-do lists and wondering whether some things on those lists are things that we really have to do. Managing our time better is also a useful skill, and I'll just mention that briefly. Obviously, avoiding too much caffeine. Many people take too much caffeine. I know, for example, as a junior doctor, when I was working alternate nights in the hospital, which was in the bad old days of very stressful rotas, I developed a bit of a nervous twitch because I had to drink lots of coffee to keep awake, but trying to avoid too much caffeine is usually helpful. So avoiding things is useful. Then altering the way we respond, because you see, sometimes, as I've mentioned, it can be relationships that are making making things difficult. Either there's somebody else and we have a difficult relationship with them, and we need to find a way of, in a sense, you know, altering the way we respond in that situation. Sometimes people feel that they've got to allow somebody else to control what they do or how they respond, and that is not usually helpful. Usually, if there's a difficulty in a relationship, it's best if we can find a way to talk about it properly, and sometimes we may need to ask someone to change their manner towards us, and we may be need to change also how we respond. So sometimes dealing with a relationship can help us, you know, and altering the way we respond, because sometimes we've always been accepting of pressure and everything else, and sometimes we need to say no, there comes a limit, and we need to express the way we feel and talk that relationship through and come to a better arrangement. Also, sometimes if somebody had a social phobia and was avoiding a lot of situations, again, learning to alter the way we respond in those situations can be helpful. And if I have time, I might mention that again. Changing and sometimes learning to be assertive. Adapting, you know, sometimes perfectionists find life difficult. I'm quite glad I'm not in that category, but if you're a perfectionist and you want to get everything right 100% all the time in everything you're doing, but sometimes that is not the most helpful way to proceed, because it's often good to recognize that you've done a job well, even though you may not have done it perfectly. You've done it well in the time available. And having standards is obviously very important, but if we can, to avoid feeling that everything has to be done all the time, 100%, because that's not the way life is. And sometimes learning to accept a degree of stress. As I mentioned before, you know, if you're learning to drive, then you recognize that it's a stressful little while. You're learning in that process, and you learn to accept that stress because the reward is worth it. If you're doing important exams, you recognize the stress is there, but the exams are worth it because they're a valuable step maybe in your career. So learn to accept some of those things. And sometimes we're in situations, particularly in work situations, where we may feel that we can't necessarily control the way that other people treat us, but we can forgive them and press forward. So those are just some ways of dealing with stress, as it were. Time management is a very useful skill, and some people are better at it than others, but it's an area that one can learn in. And some people will say, you know, in the next half hour, as a busy mother, I've got to collect my children from school, I've got to get a meal on ready for them. I must ring and make a phone call to somebody who rang me this morning, and I must, begin the washing or ironing. And you say, I've got half an hour. Well, look, if you try and do all that in half an hour, you'll just get yourself stressed out and you won't manage it. It's much better to say, I have half an hour. Now, what can I usefully do in this half hour? And what is the priority to do? Well, in that last situation, you might say, well, I must collect my children from school and I must get a meal on. Those two things I'll do. The rest will wait or we'll deal with them in other ways. So learning to use your time well, learn to say, what can I usefully do in this time available to me, and not trying to squeeze everything in. Because as I say, the more you try and squeeze in, then the more stressed you'll get and your performance will go down and you won't do things properly. So learning to plan your time and learn to do effectively what you can in the time available is very, very useful skill. So that's just briefly on time management skills. Similarly, problem-solving techniques. This is not high science, it's just more useful skill to do. What do you do when you find problems are there and you can't easily resolve them? Well, learning to write things down is helpful, because you see the tendency is, if you're prone to a lot of anxiety, you will actually allow the problem to go round and round in your mind, and you'll just keep going round and round in circles. But actually, when you commit it to paper and you then look at it carefully, then that's a way of actually facing the problem you're dealing with. And as you face that problem, then you'll find either something will come to mind that you need to do to solve that problem, which is fine, so you go ahead and do that, or you recognize that actually there's nothing that can be done about this problem, and so you leave it. And certainly that was something I used to do when I first went in to become a consultant. When I was in England doing local consultant jobs there, I was very, very busy. It was quite a step up from what I'd done before, and I would have a lot of things on my mind. But I found that process of writing things down and then doing what I could, and then in a sense ripping up the paper and saying, I can't do anything about that, I'm leaving it. That way of dealing with problems I certainly personally found helpful. And similarly with interpersonal problems, sometimes writing things down can be a very useful way of simply solving problems. We mentioned briefly last time, I think, cognitive behavior therapy. You remember we mentioned one or two therapies last time. We talked about breathing techniques. We talked about relaxation techniques. We've mentioned one or two things today. But cognitive behavior therapy is a very, very useful skill. And perhaps to give you an example of this, I can't give you an example for every area of anxiety, but you might remember, for example, that we talked about a person who might have what we call an agoraphobia, a fear of going out of the house, a fear of going into open spaces. And sometimes that can be associated with a fear of having panic attacks in certain situations. The two often go together, but not always. But in that situation, you can think of, well, a therapist could be very, very useful here, because a therapist could actually encourage the person to say, well, look, let's test things out, let's take a few steps outside the house today. Let's see if you're going to have a panic attack. Let's see if we can get through this. Let's do some breathing exercise, etc. All of those things. But also the cognitive side is saying, look, you're imagining, you're saying to yourself, if I go out, I'm going to have a panic attack. Let's test that out. Let's test the reality of that. Let's go for a short walk and see if you do. And actually you get through that. And so in a sense, it's facing the negative thoughts. This is going to happen. And actually doing a test out and say, no, it's actually not going to happen. You see, cognitive behavior therapy is based on the following. There's always a thought that comes before the feelings. And that situation is I can't go out, I'm going to have a panic attack. That's the thought. The feeling then is high anxiety. And you feel that those thoughts often go unnoticed and go unchallenged. And those thoughts are often incorrect because the therapist might go with you and then you find, oh, I managed, I didn't have a panic attack. And of course, if you can change the thought level, then actually the feelings get better and you can do experiments of that nature. Obviously, there's an awful lot more to cognitive behavior therapy. I just mentioned thinking of it as the connection between the thought, the feeling, and the behavior. That's the important thing. I can't go out, I'll have a panic attack, I feel anxious, and I stay inside. That's the thought, the feeling, behavior. Challenge that. Actually, you can go out. You can make it. Feelings get better, behavior changes. So that's a very useful technique. It's very useful also in social phobia, to try and help somebody overcome that phobic situation. The other thing about social phobia is sometimes people feel that somebody's going to say nasty things or bad things about them, and find it very difficult, breaking it up into little parts and doing a little bit more one week and next week and breaking it up into sections, overcoming that social phobia. But also, as I've mentioned, in all kinds of anxiety, it is often facing the situation, working through the situation, and often with help from others, say a therapist, and often also, well, sometimes with medication help as well. And medication, often, if a situation is severe, anxiety situation is severe, either social phobia, panic attacks, or something else is severe, then often we would give an antidepressant, which actually works with anxiety as well. I've said they're best to avoid drugs like Valium and other sedatives if they can cause addiction. There's actually quite a body of opinion that would say the addiction problems with Valium and other benzodiazepines are not necessarily that severe in every person. I mean, not everybody will get addicted to these drugs, and they can be very useful in severe anxiety. And we do use them when the situation is severe. Also, sometimes you use them in short periods, short bursts, when the anxiety problem is very severe, and then be able to come off them again. But many people are on them long term, and sometimes they can be very helpful. And we all discover as psychiatrists that sometimes trying to take people off their benzodiazepines doesn't always work. And sometimes discretion would say, actually, you might be better to stay on them. So they're still very useful drugs. As I said, when the anxiety and the panic is severe, but a certain proportion, maybe people say about a third, may actually end up getting a bit dependent on them. So medication, and then I've got those further resources which I put up earlier. So that's just a brief rundown on some further aspects of anxiety, and we've mentioned one or two other disorders associated with it, and we've also been talking about stress as well. So that's just some thoughts I have in conclusion. Also, just to mention there that the Royal College of Psychiatrists, and there are other websites as well, but the Royal College of Psychiatrists has a range of booklets on aspects of anxiety, panic, and CBT, which you can download, and they're very, very useful. And getting some useful literature on these things can be very helpful. So that's to recommend. Also, this, as I mentioned, that livinglifetothefull.com, that's a way you can engage online in that resource, and you can get help through it. It's a self-help kind of thing, as is livinglifetothefullwithgod.com. And as you see there are other ones there as well that are available. Okay, so that's that. I'm just going to see, do we have any questions in the chat? So let me see if I can find the chat line and see whether we've got any questions in the chat. Oh, I don't think I have any questions yet. So if you want to write up 1 or 2 questions for me on anything we've discussed either last week or this week on the whole area of anxiety or anxiety-related issues, feel free to drop something in that chat section now, and we'll try and have a chat about it. How's that? I'll just give you a minute or two to see if there are any questions coming up. So I'll just pause and we'll just be quiet for a minute or two while we'll just see if anybody wants to send something up now. Well, I can't imagine that you agree with everything I say. I mean, there must be somebody who's going to say, well, actually, I don't agree with that. Oh, here we have a question. Do you think social anxiety levels have increased over the pandemic amongst young people? The simple answer to that is I'm not absolutely sure. I do know that anxiety levels have increased. There have been a number of papers out there, some better written than others, but they have shown, I was reading one just yesterday, they have shown that actually, if you do a very careful study of anxiety, of people with anxiety problems before, during the COVID crisis, then actually anxiety levels have gone up considerably. Certainly in the early part of the epidemic, there's some evidence that perhaps now those anxiety levels are receding a bit, the anxiety due to the epidemic. Obviously, I don't know exactly about social phobia, but you might imagine that if somebody has a social phobia and they then are in isolation and not able to go out and meet people, that you would imagine that some of their progress, maybe with their social phobia and facing it, might have gone down, might have got worse. You'd expect that, because obviously when you're dealing with the social phobia, you're wanting to gradually encourage people to face it. As I say, facing anxiety situations is usually the right way forward. And obviously with every person, with every individual with, say, social phobia, then there's going to be a slightly different approach. But certainly the problem with somebody with social phobia is they find social situations particularly difficult because they might feel in a situation they're being negatively evaluated by other people, or other people may be saying negative things about them. And so certainly the cognitive behavior approach, looking at your thought patterns, looking at those things that might actually be negative thought patterns that may not necessarily be true thought patterns. You can imagine dealing with those thought patterns, helps to deal with the feelings associated with them, helps to deal then with the behavior. And so the cognitive behavior approach is very useful. Also self-help and things can be very useful. And obviously sometimes people will also need medication. And sometimes there might be a way of, breaking up a very challenging situation, like, I've got to go meet these people kind of in a party situation or a group situation. Then there may be a way of sometimes dealing with it by breaking it up and doing smaller steps first, rather than necessarily facing a very difficult situation immediately. So breaking it up into stages, that kind of thing can be very helpful. Obviously also in a social phobic situation, you might feel that doing some breathing exercises, as we've mentioned before last week, that could also be useful as a way of dealing with that situation. Second question is it a good idea to have a Christian counsellor or NHS for a Christian? Well, that's an interesting question. You see, some of the skills involved in anxiety and anxiety management are skills that professionals would have, both probably in the NHS and both probably also with a Christian counsellor. So for example, some of the therapy techniques of learning to do breathing exercises, learn to do relaxation techniques, learning skills through cognitive behaviour therapy, all of those things can be very useful and would come across both from the NHS and also probably from a Christian counsellor. However, having said that, you also feel that many people who would identify with some aspect of the Christian faith might also be encouraged in a sense in their Christian walk, which might be helpful, and also encouraged to look to God for help and to be able to cast all their burdens on the Lord, as it says in Peter. And so those skills are also, those things are also very useful. So I can see in some situations that having a Christian counsellor could be very valuable, but it could also be the case if any anxiety is connected with aspects of the faith. So as I say, Christian counsellor, it is aspects connected with the faith, also to encourage a Christian to unburden themselves to the Lord, that can be useful. But on the other hand, some of the other skills will be there with both Christian counselling and NHS counselling. So it's a little bit of a kind of mix that, you know, some people would find it very helpful, others may be quite happy with an NHS approach. So what's the next question? How important is the past in understanding and managing anxiety? That's a good question. We do know, for example, that anxiety can tend to run in families. We do know that certain forms of anxiety can be related to past trauma. For example, as I mentioned before, there are a number of conditions that we recognize in psychiatry where anxiety is a very big part. So for example, obsessive compulsive disorder, post-traumatic stress disorder, panic disorder, phobias, all of those kinds of things have high levels of anxiety in them. And you can see that some of those can be connected to the past. So for example, if somebody is dealing with a post-traumatic stress disorder, then you might feel that trying to face again, in a way in therapy, the stress that they've been through, because the problem there is it's not been integrated properly. It's and that's why you get the flashbacks, the high levels of arousal, etc., etc. So in that kind of situation, facing the previous trauma is going to be important. One thing I would say is that, you know, in a sense, if you're going to face that previous trauma, you know, you're going to have to be relatively robust and able to face it. And I've known in the past that I've had this conversation with patients, and I've said to them, to be honest, you know, I'm not sure that you've got the strength to face up to some of those things in the past. I think you're going to find it too difficult, and they're in whole agreement with me. On the other hand, there are some who say, well, actually, you know, if you're going to really get better, you're probably going to have to look at some of those previous issues. So it's a bit of an individual thing. I can't kind of give a carte blanche answer to that. It depends a little bit on the individual, a little bit on what they've suffered, a little bit on the previous trauma that they've engaged in. And I also just want to add in that if there are any other professionals online tonight who might want to add in a word on any of these questions, feel free, because obviously when I'm a bit on the hoof with some of these questions, I may miss out important things. So if there's any other counsellors or professionals online, feel free to dive in and give me a hand with some of these, feel free. For clinical depression, well, I suppose the question there is, you know, when you're clinically depressed, should you deal with major underlying issues? The answer is no. You know, if you're quite depressed or you're seriously depressed, that's not the time to deal with trying to go into the past, because actually stirring it all up may make things a lot worse. You know, if you're seriously depressed, for example, you need to get through the depression, through the acute phase, into a better phase before you'd start looking at past issues. That's when you're acutely depressed, that's not the time to try and face some of those more difficult issues. I think that's the questions. Does anybody else want to add in anything there? Those 4 questions I've had there. Okay, well, thank you for asking those. I'll just close that for now and go back to my slides. So I'm hopeful that some of those things we've mentioned tonight might be helpful. Now, I know I haven't mentioned much about mindfulness, and some of you may be wondering about that. I'm not really a fanatic for mindfulness. I'm not saying it's not helpful. I believe it can be helpful to some people. I therefore ought to mention it. I'm personally not fully behind it, because 1 or 2 things about it cause me some level of uncertainty. Certainly the Buddhist origins of it would have a bit of a problem for me. And secondly, also, I think it often causes people to engage solely on themselves in the moment, rather than necessarily be looking outside themselves for other help, and also being able to give. I think it focuses a bit too much on the here and now in the individual situation, in the individual, but those maybe aren't terribly strong criticisms, so feel free to have a look into it, and there are different kinds out there, so you may wish to follow that through yourself. I think the instructions of the Lord in the Gospels are helpful, and there are different sections where the Lord does discuss anxiety, and he says, for example, do not worry then, saying, what shall we eat, or what shall we drink, or what shall we wear for clothing? But seek his kingdom first and his righteousness, and all these things shall be added to you. So do not worry about tomorrow, for tomorrow will care for itself. Each day has enough trouble of its own. And I'm wondering what thoughts would go through your mind when you come across words like that. And obviously Christ here is not necessarily dealing with every source of anxiety or every anxious situation. And even Paul himself said that at times he got anxious about the fate of the churches that he planted, for example. So we can't say, you know, it's always wrong to have any kind of anxiety. That would be extending the scriptures a bit too far. But on the other hand, Christ is teaching us some practical wisdom about life. And he's saying, don't worry what we eat or what we drink or what we wear for clothing. Now, obviously, there's a difference here as well between not worrying and planning. Most of us would consider that actually some degree of planning in our lives is necessary. So we're going to go to the supermarket and we're going to buy food to eat and drink, etc. And we're probably going to buy clothes for ourselves, for those kinds of things. So there's a certain degree of planning. But what Christ is saying to us, don't be all the time worried about the future and how it's all going to work out and what is going to happen. Know in a sense that you have a Heavenly Father who does love you and care for you. So for example, in 1990, when I set out for Cyprus with my 5 young daughters at that stage and my wife. And I left clinical medicine for a while because I was planting a church, or rather looking after a church at that stage and being a church pastor without pay. I didn't know how it would work out, but I knew I had a Heavenly Father. And I mentioned last week about how God, in a wonderful way, provided for us in some difficult times that we had together. And so that, to me, was a wonderful example of knowing that I have a Heavenly Father who does love me and care for me. And some of those ways were quite remarkable. And what I think Christ is saying to us is, look, if you will seek his kingdom and his righteousness, then these things will come along with you. And certainly that was my own experience and the experience of my family, to know that as I sought God's kingdom, and that was in the church work at that time, his righteousness, all those things would be added to us. I would obviously add to that seeking his kingdom, his righteousness is not necessarily always going into full-time Christian ministry. That would be completely misunderstanding that. And we also know, for example, that Paul himself made tents for a lot of the time and used his skills in that way. But rather, in a sense, it means that we want God to be first in our lives. Seeking it first his kingdom is saying, God, I want you to be first in my life, and I want to do those things that please you. And I think that's the important thing. And so obviously, as a person, I would want to evaluate my life as I come into God's presence and say, Lord, are these things that I'm doing the things that you want me to be doing? And we may not always get a terribly clear answer on that, but I think God can quite easily show us, and this has been the case at times, that quite clearly shows us the things he doesn't want us to be doing, and that can come through clearly. But basically it means putting God first in our lives, saying, God, I really want to love you and follow you, and to trust him that he will then provide for us what we need. So he adds, do not worry about tomorrow, for tomorrow will take care of itself. And I say that doesn't mean we don't plan, we don't make plans, we do. But we're not to be consumed by anxiety all the time, because that would rob us of peace in the present. And I think one of the things about mindfulness is it is teaching us to live in the present a little bit. As I say, I don't like it totally, but there are some positive points to it. So that's a little bit about the teaching of Christ, to live one day at a time and trust him and follow him. And again, Paul writes things similarly. Do not be anxious about anything, but in everything by prayer and supplication, let your requests be made known to God, and the peace of God, which passes all understanding, will keep your hearts and minds in Christ Jesus. Again, Paul is saying there, in those lovely verses from Philippians chapter 4, which perhaps I'll just read again more slowly to give you the picture. Philippians chapter 4. Just wait while I just get my Bible open here. Philippians chapter 4, verse 6 to 8. They are beautiful verses, and they have a lot of meaning, I believe, and a lot of help in our lives to give us some clarity of direction. Philippians 4, verse 6 to 8, he says this: do not be anxious about anything, but in every situation, by prayer and petition, with thanksgiving, present your requests to God. And the peace of God, which transcends all understanding, will guard your hearts and your minds in Christ Jesus. And I think what Paul is talking about here is a definite process, Do not be anxious, but in every situation, by prayer and petition, with thanksgiving, present your requests to God. And I must say that is something that I found very helpful over many years, because there are situations in our lives that would make us very anxious, and situations where we say, I do not know what to do about this situation. But what Paul is saying here is basically saying, don't be anxious, but in every situation, prayer and petition with thanksgiving. And I think what he's trying to get us to do is to look if something is making you very anxious, and if something is, you don't know what to do about something, go into God's presence, be alone with God, and tell him all about it. And I've found sometimes in situations that can actually take quite a long time. I found times where, it can take half an hour, 45 minutes to fully unload that problem on God. And as a result of that process, I don't necessarily always know the answer or always know what to do, far from it. But there does come upon me a sense of peace, a sense that God has heard all about it, a sense that I've been able to unload it all on God. And there's a peace, and that peace often comes through that. And sometimes after I've had a good sleep the following morning, I'll say, oh, I know what to do about that. The answer is there. And it's, in a sense, pouring it out on God and coming to that sense of peace, of knowing that he is with me, that he's heard about it and knows all about it. And obviously, Paul then goes on to say, finally, my brothers and sisters, whatever is true, whatever is noble, whatever is right, whatever is pure, whatever is lovely, whatever is admirable, if anything is excellent or praiseworthy, think about such things. I mean, obviously, cognitive behavior therapy is dealing with our negative thought patterns and our incorrect thought patterns. Well, Paul is saying there's one thing you can do about that, and that is to direct your thinking to a degree. And, obviously, as the phrase goes, we can't stop the birds flying overhead, but we can stop them nesting in our hair, and there is a sense in which we can adjust our thinking and control our thinking to a degree. Not totally, but basically we can learn to give thanks. We can learn to appreciate things. We can learn to appreciate nature. We can learn to appreciate things that are good and pure and lovely. And, one thing that myself, my wife, have practiced for many years is that we tend not to say anything negative about unless it is really necessary. Obviously, there are times where you have to say something negative about some person or some situation, but there's nothing worse than running people down all the time and that kind of thing. And we find if there's something positive to say it. If there's something negative to say, you may not need to say it, you see, because that can sometimes make things a lot worse. And I don't think that's being unreal. I think it's actually concentrating on the good in situations. And then that last verse in Peter, which is one that possibly people know quite well, is casting all your care on him because he cares for you, which is a very important thing to do. And in a sense also covers some of that ground on those verses from Philippians. I want to end with some lovely verses of Christ, which we'll probably know quite well, where Jesus says this. He says, come to me, all who are weary and burdened, and I will give you rest. Take my yoke upon you and learn from me, for I'm gentle and humble in heart, and you will find rest for your souls. My yoke is easy and my burden is light. Just breaking that down just a little bit. Obviously, Jesus says, come to me, and that is so important. It's not necessarily going to all kinds of different sources. Coming to me, not to say the other sources aren't right or helpful at times, but the important thing is to come to him, all those who are weary and burdened, and I will give you rest. And there's a sense of just knowing that Christ is the source of rest. And again, that word rest comes again. And so much of this modern world is not at rest. And Christ wants us to be at rest. And that rest is important. and Christ promises it to us. But then he takes us through a little process. And he says, take my yoke upon you and learn from me. And in a sense, they would understand that immediately because it's taken from an agricultural context. And the people would have observed maybe the oxen ploughing the field. And of course, in those situations, you'd often put a more senior ox with a junior ox, and you'd yoke them together. So the younger ox would learn from the more senior partner, as it were. And the farmer would know that if they didn't yoke the oxen together, then of course one ox might go one way and the other might go the other way, and the field would be an awful mess. So he yokes them together so that the older ox can, in a sense, give direction, and they'll walk in the same direction and the field will be ploughed properly. And of course, that is so easy to understand now in relationship with our relationship with Christ. You know, taking his yoke upon us means to say that, Lord, I will go in your direction. For example, if you are driving a car and you're a very bad driver and you're having lots of accidents, the idea might be to put somebody else in the driving seat and you sit in the passenger seat and learn a bit more until you're a bit more competent again. The same here, you know, that God is saying, look, let me be the boss in your life. Let me lead you. Let me guide you, and you learn from me. But then he adds, for I'm meek and for I'm gentle and humble in heart, and you'll find rest for your souls. You see, so much of our lives are disturbed and know so little rest because of pride. And pride obviously is hateful to God, and saying, oh, look, I can do everything myself. No, gentle and humble. Jesus is gentle and humble because he always does exactly what his Father wants. And we need to learn that same spirit, to be gentle and humble and say, Lord, what is it that you want me to do? And how should I follow you in my life? And how can you lead me and guide me? And then it says, you'll find rest. You see, pride leads to a fall, and we get all over the place. But if we're humble and gentle and look towards the Lord, then we will find that rest. For he then adds, my yoke is easy and my burden is light. And that's the invitation that Christ gives us, to follow him in our lives and with our lives. And as I usually do, I just have a little prayer at the end here, that if you like to pray with me, feel free, but have a look at it first. And it's just a prayer from our hearts to the Lord. Lord Jesus, thank you that you laid down your life on the cross for me. Thank you that from that cross flows forgiveness and new life. Lord, I turn away from living for myself to live for you and to follow you. You are the good shepherd. I invite you to come into my life, to be with me and help me each day. It's basically saying, Lord, I'm so grateful for what you've done for me. I'm so grateful for the cross. I'm so grateful for forgiveness. I'm so grateful for new life. And Lord, in response, I don't want to live for myself. I want to live for you. You're the good shepherd. And I trust you that you can lead me and guide me. So I invite you to come and be with me in my life and to help me each day. And he will do. As I say, we don't necessarily always feel his presence with us, but there come times where we say, Lord, I'm so grateful that you are with me, that you love me, and you're with me in all that I go through. So if you read that prayer, I'll just pray it once more, and you can join in with me if you wish. Lord Jesus, thank you that you laid down your life on the cross for me. Thank you that from that cross flows forgiveness and new life. Lord, I turn away from living for myself to live for you and to follow you. You are the good shepherd. I invite you to come into my life to be with me and help me each day. So there we go. That's really the end of this series. I'm so glad, as I say, to have had you with me. I'm so glad that you've been able to stick with me on this series. And as I say, I will try and get it up onto my YouTube site so you can see it there. And you may also like to look at some of the other things that are up there. So thank you so much, and God bless you in every way. Thank you.